Expert Talk.
Hello everyone, I'm Dr. Peyman Raoofi, clinical psychologist, here with you on another episode of our show, Expert Talk. Here at Ayeneh Foundation, our goal is awareness, education, and prevention. We are do best to get the help from nonprofit organizations, media, and you, the people. Here in the Ayeneh studio today, there is a very good friend of mine, a good clinical psychologist and advocate that we will be talking about how to find a therapist and how important it is to have a therapist at the times that we need one, and what are the criteria we have to watch out for when we are looking for a therapist. A psychologist, a marriage family therapist, a social worker, a life coach, and there are so many of these mental health professionals out there that sometimes they could be confusing to us, that who should I see? So these are some of the points and questions that I'm going to be asking our guest today. Let me first introduce Dr. E or Dr. Richard Espinoza. Welcome to the show.
Thanks for having me again.
Great to have you here at the studio, and thank you for accepting my invitation and being here. Dr. Espinoza is a clinical psychologist, and he works with people with different diversities, diverse identities, diverse backgrounds, sexual orientations, and people of all ages. He has been working with clients with trauma and resilience, recovery, LGBTQ+, and he also has a psychology-informed matchmaking program. All right, so today we are talking about finding a therapist and challenges in seeking a therapist. And let me ask you this. When would be the right time for someone to seek a therapist?
I would say that very first inkling one has of, ooh, I think I need to talk to somebody about this, that first moment. And sure, sometimes you can satisfy that with a religious leader, with an elder in your community, or any type of trusted loved one. And if that works for a person, fantastic. But if people feel like they need that objective support from someone who maybe is outside of their inner circle, that's that moment, that first moment where you think, hey, maybe I need to talk to somebody about this. That's when I advise people seek therapy.
And of course, right there, it's going to be the question of who should I see? Should I go for a psychiatrist who prescribes medication? Or do I need a psychologist or marriage family therapist, MFT? So how they can navigate through that?
I mean, yeah, these are all really good questions. And first and foremost, this comes informed by my time as being a consumer of professional psychology, being the patient, and also now 15 years deep of being the provider of professional psychology services. So in my own personal search back in the day, looking for someone, I didn't know the difference of this. I was studying this field still, but I didn't know the difference between a licensed marriage and family therapist, a psychologist, a psychiatrist, a psychoanalyst, and then during my time entering school, the notion of a life coach was starting to become popularized. So I had no clue what these things were. And the simple Google searches I was doing in that time didn't always yield the right answers either.
Right, so it's going to be a lot of different options for people to choose from when they are thinking about, a mental health professional. But to just give a brief information about who these people are, a psychiatrist is a medical doctor who has gone to medical school and has a medical degree, but they've done their extra education on psychiatry. And they work with patients that they are suffering from mental health disorders, and they are able to prescribe medication for them. They do also provide psychotherapy, and they are trained and they are able to sit in a session and talk with a client. However, their main focus would be that medication management and being able to prescribe medication and so on. Then we have the psychologists who they have a doctorate in psychology, and they have been trained in psychotherapy, assessments, evaluations, different methodologies and theories and approaches on how to treat a patient, which is a psychologist with a doctorate. And then we have marriage family therapists that they are more trained in working with families and children and marital problems and relationship problems and so on, but they have the master's degree of MFT or marriage family therapist. We have social workers that they do also provide therapy, which they do have a master's in social work, and they can also provide therapy and psychotherapy. However, I really look at them more of people that they have a much better knowledge of the resources in the community.
Yes.
And how they can connect people to those resources, and the work of social workers in family crisis, in children's crisis, and different ways. I've noticed it's very crucial and very important. So did I miss anyone that you want to add?
I think we also have LPCCs, licensed professional clinical counselors. So that's one more avenue and one more thing that could be very confusing for the average consumer. Then under that as well, we also have life coaches, which my knowledge on life coaching is informed by completing my dissertation on exploring what exactly is a life coach and how does that differ than psychotherapeutic services. So the list goes on. And so I can see why it's confusing for the average consumer.
Right. But later on, we will be talking, I will be asking you about the licensure and accountability. So let's hold on that, and I'm intending to ask you when we are further in the show. Okay, when people decide that they have to see a therapist, one of the questions they usually ask is, should I see someone that understands me, my culture, my heritage, my language, my let's say sexual orientation? For example, if someone from the community of LGBTQ+ wants to seek a therapist, should they think about finding someone from that community, or they can choose anybody?
I think first and foremost, a person deserves to work with someone that resembles them, maybe looks like them, behaves like them, or generally has an understanding of the communities they come from. We're intersectional creatures, we're multifaceted, and sometimes our mental health struggles are rooted in one of our intersections. For example, maybe you are a woman facing discrimination in the workplace. Maybe you want to work with a fellow woman. Or maybe you're an LGBTQ+ person struggling in the dating world. So maybe you want to work with an LGBTQ person who you feel could have a general understanding of your world and your lifestyle without having to educate that therapist on who you are.
All right, so your recommendation is the person should seek someone from the same culture and background and orientation.
I do recommend that in the first place. However, I have worked with individuals that simply just didn't mind. They believe and trusted the training and credentials of the therapist. They know that they can hold an objective lens. And I've worked with a few people that actually didn't care.
Right. You know, my understanding is that a therapist should be a blank sheet of paper that you know a client can define the culture and the background and whatever the client is or coming from, and then the therapist can work with that person in front of him or her in the session without having any biases of the previous understanding of different cultures. What do you think about that?
I hear it. What I always caution my graduate students on is that we are never going to be a blank slate.
Right.
You walk into a room, you have a certain presentation, and we're a very visual species for everyone who is sighted. So you're going to see the individual and make certain assumptions. Your brain certainly will. You're going to hear the person, how they talk, what dialect they use, what language you two are communicating in, and that informs our world as well. And then on top of that, you know, all your senses are going to be stimulated by this other human in the room. And not to mention, maybe this is through telehealth. So Maybe you are working with a person hundreds of miles away from you, and they may have a different society and culture they live in and think through. So there's so many intersections. So again, I encourage people, find someone that you feel comfortable with, maybe based off similarities in your intersections. But if that's not something you highly value, that's great. You can trust the objectivity of us. So back to the notion of the blank slate. That would be nice, but I just don't think it exists. Even Father Freud himself, who brought up the notion of the blank slate, he had his own presentation. He didn't even follow his own rule.
Right. You mentioned a very good point, and that was the telehealth. So it's kind of new to our field to have the telehealth and having the psychotherapy through telehealth. I can say mostly after the pandemic of COVID. We are hearing more about telehealth and having like the virtual therapy. Insurances, they started paying for it. So now it's more common. And usually people ask when they call my office and ask me if I provide any in-person, any virtual, and sometimes they ask if there is any preference from my point of view. Let me ask you this. Is there any preference between the in-person sessions or the virtual telehealth sessions?
So I would say yes, with an asterisk. So I feel it's condition by condition. So for example, a person living with ADHD, they greatly benefit from the in-person therapeutic experience. It limits overstimulation and distraction. Or flip it on the other end. A person may be living with and attempting to overcome agoraphobia or social anxiety. A person with those two conditions, for example, might benefit from starting off with telehealth, meeting them where they're at, and then possibly transitioning to in-person services, if that's part of your treatment plan, or simply just maintaining it there. I mean, that said, I've had the gamut. I've had therapeutic relationships that completed solely in person. I've had some that had to transition to telehealth during the pandemic and began in person, and they graduated during telehealth. I've also had people that started with telehealth and ended with telehealth. And then the opposite. I've had people start with telehealth and then end with in-person. So it really just, again, meeting people where they're at. Different conditions require different forms of treatment.
I generally am very, very glad that the telehealth is on the rise, because it makes it possible and accessible for so many people in different areas. And some people, because of their time and commute and so on, they were not able to actually go for in-person sessions, and that was the reason they were not seeking therapy. But now, because this virtual or telehealth is possible for them, now they can access it, they can get the therapy, and it is very beneficial for them.
And also, too, my work with older adults. Previously, sometimes older adults may have physical limitations. And sure, some that are truly motivated can still find access, like maybe with the help of a social worker, granting them access to social services. Maybe they'll get their access transit ride and bring them to your office. Sometimes that can be really arduous too. So for example, an older adult living with physical limitations, well, telehealth is a much more viable option. And once again, meeting the clients where they're at, sometimes people just more prefer a telephone call, a Zoom call, to see each other's face at least, or sometimes, again, they want to have the in-person experience. It just grants access to people with various needs and desires.
All right, so let's say that someone has made the appointment and they are there for the first session. How they should start that first session?
Ooh, that's a really good question. So I feel, again, I tell this to my graduate students, it depends on what theoretical orientation you're planning to apply. That said, sometimes we come in with the best ideas of a treatment plan, and turns out that that's just not a good fit actually for the client when rubber meets the road. So I always say, defer to your theoretical orientation. So you've been applying this for years, and see where it goes. Some people really benefit from a structured format. So I always suggest in the consult call, let them know how much, or ask them how much they value structure. You could have a very structured intake with a bunch of checkbox questions. Some people feel contained by that structure. Other times, and I speak from my own experience when I was working with a psychoanalyst, it was psychoanalytic psychotherapy. So there was a face-to-face aspect. I wasn't lying on the couch away from her. And simply the intake was the first session, I sat down and she did this. And we had a beautiful therapeutic relationship. So that was less structured than the average person might appreciate. I loved it. And I've also attended structured intakes where it's, filling out a checkbox form.
Very good. And usually one of the questions is that how long this is going to last. How many sessions should I be coming? How many months or years should I be planning for this therapeutic relationship? What the answer would be to that?
Again, my first point is defer to your orientation. Is it, for example, cognitive behavior therapy, which does lean towards a shorter term model. But people don't always even know what that means. So in the literature, long term is 25 plus sessions. So if it's on a weekly basis, maybe that's only really just 6 months. If you are in a more depth work, open-ended, you could be working with an individual for years. So like on my current caseload, I have an individual I've been working with over a decade. I also have short-term models. What I notice with healthcare insurance is they tend to do it in numbers that are divisible by 3 and in increments of 12. So over the past 15 years where I've had a relationship on and off with health insurance, I've adopted that same model. Typically what I do is I work with people in 12 session chapters. If you benefit at the end of 12 sessions, roughly 3 months on a weekly basis, great. Maybe you graduate from therapy. And if you feel you would continue for ongoing support, then we renew another chapter. So just increments at a time. Again, meeting people where they're at, not overwhelming people, and understanding some people, God forbid, do well and graduate from therapy, and some people benefit from ongoing support.
Gotcha. All right, you mentioned orientation. And if someone is looking for to find a therapist, should they be aware of what is the orientation, what different approaches are out there, and the therapist is following which school of thought?
100%. So on one end of the client and consumer's end, I highly encourage individuals seeking therapy, just do some of your own research and look up what some of the hundreds of theoretical orientations even are. What does that word even mean, orientation, and see what just speaks to you. On the provider's end, this is already a part of evidence-based practice. We want to have proficiency in a certain orientation. We want to be up to date on the literature, and we want the client to also have that buy-in too. That's evidence-based practice. So if all parties, client and provider, are aware of this, that's evidence-based.
All right, so we have cognitive behavioral therapy, we have psychodynamic, we have humanistic approach, we have so many of different kind of approaches that sometimes even therapists, they do advertise about what kind of orientation they have. How much of this information the client should have before they choose who they want to see?
I think it's imperative, and I think it needs to be addressed even before the relationship begins. I feel ideally in the initial consultation. Not every provider actually does an initial consultation, but I feel that's a healthy, non-committal way to just test drive each other. Do a person's concerns fall aligned with the provider's skill set, and does the provider's skill set actually address what the person is presenting with?
Is it beneficial to the client to kind of educate self before going to the therapist to see what are the orientations out there and which one they feel more connected to?
I'm biased, yes. I always feel growth begins with the self. So self-education, self-investment, and just doing one's own research.
All right. Is there any specific orientation that you would recommend for any kind of a specific problem?
I, as always, tie it to the symptoms. So if doing your own research, you realize, okay, my panic episodes, the literature suggests might be treated within a 12-session model, great, go for that. If you're looking for, just for example, exploring self-identity in the form of I'm a creative type person. I like to write poetry. Do I consider myself an artist? Should I actually invest full time in being a poet and maybe consider going to graduate school for poetry, for example? I think that's a deeper seated thing to explore, and that probably takes more time. So yes, starts with self-education. What does the research, the literature, or what does my Google search suggest? How long does this matter take to recover or learn from it and grow? And then bring that to the providers you do consultation with. That said too, I fully support people seeking therapy, shopping around, and just being upfront about that. It's okay, it's an intimate relationship that's oddly professional at the same time. And like the last time I was here on your show, intimate relationships are challenging. They're very nuanced, and so they take time. Go try different therapists, try on different hats, and just see what works.
Thank you, Dr. Espinoza. Here we are at the mid part of our show. Let's take a quick break, and we will be right back.
شما به آینه نگاه می‌کنید.
Welcome back, everyone. I'm Dr. Peyman Raoofi, clinical psychologist, and here in the studio I have Dr. Dr. Richard Espinoza, clinical psychologist, with me. In this episode of Expert Talk, we are talking about seeking therapists. For those that they feel like it's time to talk to someone, we are giving some information about how you can approach that from the day you realize you need to talk to someone into going into the session and actually sitting with someone that you want to take the benefit from a therapist and talking to a therapist for feeling better soon. All right, so we in the first half of the show we talked about life coach. And we know life coach is not necessarily a psychologist or a psychiatrist. It could be anyone with some degree of training in approaching, different problems and so on and so forth. Let's have a kind of a comparison between someone who is, let's say, a formal psychologist, because especially in the state of California, no one can call themselves a psychologist unless they have a doctorate degree in psychology and they hold a valid active license from the state board in psychology. So let's have a comparison between a life coach and a psychologist.
So this is all informed by my dissertation topic, which I was just curious. I heard about the notion of a life coach in the early 2000s. I had no clue what that was, but I was curious about it because it sounded very popular and people were motivated to receive this type of service. Life coaching, to the best of my knowledge, it's a person who feels internally they have a certain level of expertise in a certain subject, and they are willing to sell that professional service to people who are willing to receive it. To my knowledge, there's still no governmental boards in the United States. There are some in the UK, United Kingdom, and also in Australia. So they actually can obtain a degree in coaching psychology. So a person who is a licensed mental health provider can provide coaching, and a coach is not necessarily a licensed mental health provider. Not every licensed mental health provider has training in coaching or even wants to provide coaching. And there are also some limitations, or should be some limitations, that the ethics boards still have opinions on regarding what a coach should be allowing themselves to provide.
We have this notion that a psychologist does not give solution, does not give advice. So a psychologist's role is not to give someone, oh, you have to get married with this person, it's a great decision. Or you have to get into this business, the business is really good, it's blooming, and it's going to help you a lot. The psychologist is there to help someone to make their own decision.
Yes.
Is the role of a life coach different from this?
Yeah, it sounds vastly different. So a person who is identifying as a coach and marketing their services as such, again, they don't necessarily answer to a governmental board. So they are allowed to provide direction, guidance, and even strong guidance in the form of giving instructions on what to do. That said, too, us as licensed mental health professionals, we can provide strong guidance as well. We do have solution-focused therapy. So providing solutions and strong suggestions is inherently a part of what we do as well.
Okay. All right. So if someone wants to choose from like a psychologist or a life coach, what are the elements they have to consider before which route they want to go to?
I would suggest first off starting with what goals are you looking for? I feel a goal can be separate than a problem or a concern. As a coach, a coach is not supposed to provide a diagnosis or provide treatment really. From the results, like drawing from my own dissertation, a coach is meant to take a positive psychology at most or a strengths-based approach at most for that, not providing a diagnosis, and if they do determine somehow that a mental health concern or diagnosis or something diagnostic is occurring, that they should defer to a licensed mental health professional. Or if they are also a licensed mental health professional, they need to explicitly and in writing shift the dynamic to maybe a doctor-patient relationship rather than a coach and client relationship.
All right, very good. I think it's a good time to ask about credentials of a mental health professional. What are the credentials? What is it out there?
So for us as psychologists, and this is also informed by my knowledge of teaching for LMFT, LCSW, and LPCC, as well as psychologist programs. So I do get the benefit of knowing what their worlds are like. For us, we need to obtain a degree, a clinical degree, a professional degree often, and then, like you were saying, complete board exams with governmental board. For us as psychologists, we take our national exam, the EPPP, and then for us in California, we take the CPLEE, which is a state-specific jurisprudence for that. That's what
law and ethics.
Yes, thank you. And that's meant to keep us accountable and just up to date on current laws, ethics, as you mentioned, and just what people do in the state of California, especially when pathology or just problems, concerns arise and how we treat them.
Right. And then those of other disciplines, let's say that the MFTs and social workers, they have to obtain that from their own board of regulatory board, which is the Board of Behavioral Sciences in California.
Correct. And then for us as psychologists, it's the Board of Psychology. Nevertheless, there's still a governmental board that have certain standards and that we need to demonstrate competency in these forms.
All right. So is it important for someone to be licensed if I want to choose a therapist? And I have an option for someone who doesn't hold a license or an active license. Sometimes might be economically more affordable for me to go to that person, or someone who has an active license. Why is it important, if it is, why is it important to have a license?
I would say a
license to practice.
Understood. I would say a license to practice is crucial because it keeps us accountable. We have to provide the highest level of service met by a certain standard that's across whatever domain. So for us, it's the state of California. So we know when you're working with a licensed clinician in California, they had to meet a certain level of standard for the entire state for all of us. And if we harm a person, which is not our intention, but if we harm a person, for example, by our methods, we are held accountable for that. There's someone that the consumer, the client, can report this to so that that individual, that clinician, it's investigated and for whatever appropriate means are taken to either discipline, course correct, or help that clinician not make that mistake again. that helps keep us accountable. So yes, I feel having a board license is crucial in this work.
And it's very surprising to me sometimes that I get these reports from the Board of Psychology for how many licensed clinicians actually they get into troubles because they do violate the laws and ethics, or they might have hurt the client. And there is that accountability for those that they are licensed to actually have a body. They have to go and report, or they talk about what they've done, and it's going to be some protection for the consumers.
Mm-hmm.
Yeah, and if there is not any protection for the consumers, which in some of the disciplines in the mental health services, there is some of them that there is no protection. And if anything happens, where they can go, where they can complain, where they can actually seek more help.
Agreed. First and foremost, as I was always told through the licensure process, our number one concern is patient care. It's the clients. How well are they doing? And I always remind myself often, and my students, that the California Board of Psychology is a subset of the Department of Consumer Affairs. Our number one priority is the people that we serve. And so hopefully it does give our clients a sense of safety. And for example, there is a phone number they can call if they feel just somewhat uncomfortable about the services they're receiving. So it's not like they have to immediately file some sort of report, but if they just need to consult, maybe talk it out, what they experience, they have a phone number that they can call. They have an email that they can find, and it's all readily available on the internet. So it's that level of, again, accountability for us, but also just safety and structure and framework for the people who receive our services.
Right. And us as psychologists or as licensed practitioners are the ones that with our licensing fees, we make that services available and provide it to the consumers. And we, as clinicians, we really want that body to be there to help the consumers when the help is needed, or the regulations and the ethics and the trainings that the clinicians need, that regulatory body is actually asking us or keeping us responsible for it.
Yes, and I like that. I also want to take a moment to sidebar for that. I use the word consumer interchangeably with client and with patient.
Yes.
And people have various opinions on the word patient alone, the word client, and the word consumer. I use consumer broadly, as does the board, because yes, you may be in a doctor-patient relationship with a therapist, or you may not. Perhaps you attend their lecture. Perhaps you watch one of their videos on YouTube. Perhaps you're their student. Perhaps you read their book. You consume their work somehow. So that's why personally I feel comfortable using the word consumer for the people that we serve.
Very good explanation for that. All right, so we are at the moment that there are people have chosen their therapist, they are in the room with a therapist, and they are working together. And is there any specific challenge that you can think of when someone, a consumer, is at the office of the therapist, and they might see that as a challenge?
Perhaps the challenge is exploring the difference between coaching and psychotherapy itself?
No, in general, and let me give you an example. Paying the fee and different ways of how this therapy is going to be handled financially. We have insurances that they could cover the session. There is copay. There is some people that are not contracted with any insurance panels. They have only cash only basis, super bill. If you can give some sort of definitions, understandings of what are these challenges.
And being realistic, times are tough right now. Okay, we're in an economic decline and money's tight. And at the same time, people are facing challenges as a result, and yes, want to benefit. And there is the understanding that talk therapy can be an expensive service. On our end, we deserve to be compensated for our time, and I'll always argue that. But yes, it also can come at a high cost for the consumer. So yes, there is health insurance, and we can have an entire episode series on my brawling relationship with health insurance companies, but I'll be brief. Yeah, it can get expensive. So some people Most of us who have health insurance benefits, it's provided by our employer. So we're providing labor with the hope that our health care, including mental health care, will be covered by that or significantly subsidized down to an affordable copay. Unfortunately, that doesn't always happen. However, not all hope is lost. If you find that you were initially trying to work with a therapist through insurance and the insurance isn't providing the care that it's supposed to, you can still seek a private arrangement with that provider, perhaps request a sliding scale. Most of us are happy to do so and meet you where you're at financially. Or if you are in a place where you can afford out-of-pocket therapy, that's great. You cut out the middleman of health insurance, because oftentimes health insurance, they have their own policies and metaphorical hoops to jump through. So there are many ways. Some of us also provide, and our ethics code encourages us to provide pro bono services for certain populations. I encourage my students to start thinking about this, and I do this myself. I have pro bono slots for specific populations, then I have sliding scale slots for specific populations, and then I have my standard fee for other populations, including health insurance that can be accepted. So you name it, there are ways to afford psychotherapy. It is affordable in some degree.
All right, very good. Confidentiality. One of the very important parts of our field is confidentiality and keeping everything confidential. What's happening in the session as far as what is being discussed is going to be confidential, 100% confidential, and that makes the client or the consumer feeling comfortable to come to therapy. What can you add to the confidentiality importance of the therapy?
I do agree. It is the crown jewel of our profession. A person needs to feel safe and secure, also with the notion that what they discuss intimately with that provider is not going to find its way elsewhere without their written permission, of course. So it's our crown jewel, and it is something as licensed mental health providers we have to provide, and we can be held accountable and be punished, so to speak, for not doing that. That also hopefully provides a bit of security to consumers. Regarding coaching, if an individual is a licensed mental health provider and they provide coaching, still our ethics code assumes all of that. So if we are a psychologist, for example, who does coaching, executive coaching, dating coaching, we are still expected to hold ourselves to the standard of the ethics code. For unlicensed individuals who apply coaching, there really isn't a standard for that. I hope individuals who simply apply coaching do hold themselves to some sort of personal or moralistic standard. Just, however, to my knowledge, there isn't a governmental board that holds coaches to that.
Yes, that's my understanding as well. So that confidentiality is very important to be kept. However, there are some situations that confidentiality can be breached.
Yes.
And what are those?
So, again, I'm always telling my students this. So, and my spiel that I give to my clients is the 3 instances where I may breach confidentiality and notify an authority is if I suspect the client is going to kill themselves, kill somebody else, or if I suspect someone is abusing a minor, one of our elders, or someone who's legally conserved. And then I always tell the client and assure them, other than that, everything else is fair game.
Right, and these are the situations that the help will be sought, and that would be only topic that will be revealed. So nothing else about the person is going to be talked about or revealed in any of these situations.
Yes, only the information as needed, which is reminded and instilled with us through the jurisprudence, the law and ethics exam. So that's why it's a beautiful thing.
Right. So, all right, I think I almost covered most of the questions I had, but as usual, if there is anything that you would like to add, we are almost at the end of our show, and if there is anything you feel like it's important to be mentioned, please.
So if you're in a place right now, you may be struggling with something or just have a curiosity about your life, this is all appropriate to first and foremost, sit with this with yourself, explore this, and then once you come to a place of better understanding, maybe through talking to trusted loved ones, maybe doing your own research, it's then great to seek out consult from as many people as you can. If you feel comfortable reaching out to coaches, licensed mental health providers, including psychologists, do so. I think a lot of us in the provider end of this, we're eager to work with you. So if you type in an individual's name in a search engine, if you look at certain websites that form directories for providers, it's out there. And once again, it was mentioned earlier, there is something within your budget. All you have to do is have a mildly uncomfortable conversation about finances. I know people don't always like that, but once that's out of the way, once you swallow that frog, so to speak, you can find healing, growth, and strengthening in your life.
Thank you very much, Dr. Richard Espinoza, clinical psychologist. Appreciate your time, expertise, and experience that you shared with us today in this show. Thank you so much for listening and watching this show. I hope this was helpful to you and your family members and loved ones. Please share your ideas, suggestions, opinions with us through the email address on the screen. And we hope everywhere, wherever you are, stay healthy, happy, and hopeful. Till next time, goodbye.
Expert Talk.